Welcome back to the Now Morning Show. I'm Kimberly D'Souza in your company. And of course, tomorrow, April 2nd, is actually World Autism Day. So to speak to us a little bit more about autism and how we can spot someone with autism, we have Dr. Liesl Windsor, who is a Developmental Behavioural Paediatrician. And we're going to talk about Autism Spectrum Disorder awareness. Dr. Windsor, good morning, and thank you so much for joining us.
Welcome to the Red Club. Let me just say, because from my red shoes to her red jacket to your red gas up, we match.
Great minds. Now, Dr. Windsor, just give us a little overview about what exactly is autism.
Yeah, so autism spectrum disorders are essentially developmental disorders, meaning that you start seeing signs in childhood, and they're caused by differences in a child's brain, the way that child's brain develops. These changes can lead to differences in behavior, learning, as well as communication. And so, as I think most people know by now, it's called a spectrum for a reason. And that's because when you meet one person with autism, you've met one person with autism. Right. And people can look very different, behave very differently, have different strengths, different challenges. And so it's you know, there's a variety of things going on.
Right. And granted that it is a spectrum, there are also other degrees or different degrees to which you may exist on that spectrum, some of which have different titles of their own, Asperger's and other items. Items is not the right word, but other variations, I guess?
I know what you mean. And so when we think about the way autism is diagnosed, we have criteria. Okay. Over time, those criteria have changed. And also, as far as that question of Asperger's, etc., there have been other ways to describe autistic persons, but for right now, the term autism spectrum disorder captures all of those sub descriptions. And so that's again why it's called a spectrum, is because you no longer have that differentiation going on just in terms of how it's described.
Right.
Now, as much as we understand more of what the actual disorder is, in terms of spotting it, say we wanted to say, okay, maybe I should go see Dr. Windsor. What are some of these symptoms or signs that we can look out for?
Yeah, so in terms of diagnosis, what doctors are really looking for are two main things, right? How does this child communicate and how do they behave, right? And so I would say anytime you're seeing that there are differences, challenges with behavior or communication, then parents should start thinking about, okay, what next, right? More specifically, when it comes to autism, communication challenges can look like no language development or missing language milestones. It can look like you're meeting the milestones in terms of learning the right number of words on time, but you're not using those words to communicate, right? It can look like challenges with developing relationships, not really being interested in other children, for example. And then, of course, we have the behavior piece, right? So anything that is repetitive and we don't quite know why a child might be doing it over and over again. So it could be anything like opening and closing doors, or lining things up, or you know, playing with things in an unusual way, either things that are not toys, or playing with toys in a way that they weren't necessarily designed. Those are all things that we should kind of start thinking about. Is there something else going on?
No, I'm racking my brain here. But as an adult, I know it's developmental. So yes, we look at it in children first. But as adults, there is a very high possibility of being on the spectrum and not necessarily being diagnosed. Would the symptoms or signs look different for adults?
They absolutely can. You know, autism is described as a developmental disorder or a neurodevelopmental disorder because the signs they have to be present from childhood, right? Now, just because they're present in childhood doesn't mean that they're always obvious enough that a diagnosis can be made or is made in that childhood period. And so as that child grows, the challenges change, right? So relationships become more nuanced. It becomes more challenging to navigate those relationships. And so we have, you know, a generation of adults who are now learning more about autism and seeing themselves reflected in some of the descriptions of autistic behavior.
Well, that explains a lot to lots of people this morning, I'm sure.
Yes. Now, Dr. Windsor, I was just wondering about, how people can misdiagnose autism, because you mentioned, about the, maybe with the speech and they're not saying words and that kind of thing. I think normally for parents, it's like, okay, he's 2, he's not speaking, let me take him to a language specialist, or let me take him to a speech therapist. How do they know, to get that deviation or to get that difference?
So, it's a good question. I think one of the most challenging things about autism is that there's no blood test, there's no scan, there's no, diagnostic test that a doctor can send someone to get done, that seems as definitive as other medical diagnoses. And so, in terms of the question of how it could be missed, I mean, like I mentioned, not speaking at all is one thing, but you can have a child who has autism who knows all their letters and numbers, can label everything under the sun at 2, and so this child might be seen as being advanced, and they are advanced in that area, but then we start looking at how they use that language. That's when we start to get into the social communication challenge that really underpins the diagnosis.
Right, and then on the flip side, of course, then how do you test for autism?
So, an assessment for autism really has a lot to do with, first of all, what the family is seeing at home, right? So because it's a behavioral diagnosis, right, what a specialist like myself or a psychologist will do is that we'll meet with the family, we'll have a deep, long conversation about what this child's development has been like, how are they using words, what is their behavior like at home, right. And then we see them in person sometimes we can also do virtual assessments, right, depending.
Because the pandemic.
Right, exactly. And what we're looking for is exactly those things. How does this child make requests? We might do some playing to see if they play with toys in the way that they were designed, right? How does this child share and show things with their family? Do they do those things? And so the assessment itself can be pretty flexible, but we're looking for those core signs that I mentioned in terms of deficits or challenges with communication and with behavior.
Let me segue a little bit, because we have explored what it is. We explored how it's tested, some of the signs. But living with autism doesn't have to be a burdensome or in any way have a negative connotation. I think it's something that we need to be cognizant of course. But how normal of a life can we lead?
Yeah, so I think it depends, right? So coming back to autism being a spectrum, right? That question really harks back to what is a child's strengths, what are their challenges, and what is their ability to learn. How well can they learn new skills, right? And so there are certainly adults with autism who live independently, are employed, are happy and healthy, right? And so I think for many of us, in the field, what we want to do is try to support all children with autism so that they can have the best possible outcome, whatever that outcome is.
Yeah. Now, Dr. Windsor, for parents, of course, parents don't really like to hear that their children have a learning disability or they have disabilities. What can you tell, to parents who, they probably think their children are autistic and they want to bring them for help? And if they have been diagnosed as being autistic, what are some of the things they can do to just, make their life a bit easier?
Yeah, so getting a diagnosis of anything in your perfect child is something hard to hear, right? And so in terms of what they can do, I mean, there are certainly therapies that are available, right? And the therapies are not targeted at fixing, right? They're more about how do we find the areas that are more challenging for this child and then provide support in those areas, teach them the skills that they need to make progress, right? And for parents, I think parents often underestimate just how powerful their work at home is, right? So yes, we have therapists, yes, we have physicians, we have specialists, but parents are the ones who are on the ground doing the work. And so, I think what I would say to parents is don't underestimate the power that you have to effect change in your child's life and to build an environment, advocate for services that will help your child continue to make progress.
Nice.
That's a very valid point to advocate for services that will help your child to continue to make progress, because as you say, it takes a village.
It does. It really, really
And I
does.
particularly enjoy the fact that you are speaking power into the parents, because as you rightfully say, yes, they are empowered, but sometimes we really don't think of it that way. It really is about providing that support as you would to them, for them to transfer that support to their children. Beautiful stuff.
Of course. Now, Dr. Windsor, in terms of support, any particular, I guess, people we can reach out to, or any
organizations,
physicians or psychologists that we can reach out to if we suspect that somebody may be on the spectrum and we want to take that assessment?
Yeah, so I always recommend, if you have a concern about your child, it could be their behavior, it could be a cough or cold, doesn't matter. Your pediatrician is your first stop. And I always talk about children because I'm a pediatrician.
Of course.
Right, but similarly for adults, you can always start with your general practitioner, your internal medicine doctor, right? Let them know what your concerns are, and then let them know that you're pursuing next steps. How can I get a definitive diagnosis? Where should I go? Right? And so next steps may look like a referral to, depending on your age, a developmental behavioral pediatrician or a psychologist. Right? And so that's just kind of the sequence of events, but always a good place to start off with your physician, whether it's your pediatrician or your GP.
Good stuff.
Sounds good.
Well, Dr. Windsor, thank you very much for not just joining us, but educating us, giving us a sense of direction, and to those looking on a wealth of information that you guys can revisit, because, of course, it will be available online through Facebook. You can, of course, look for Dr. Windsor as well. And in the meantime, we will take a break, come back with more right here on the Now Morning Show. Stick around, guys.
When I'm feeling well uptight, you know we looking for